Hello, my name is Nicole, and this is a presentation on cardiovascular disease in the country of Guyana. Guyana is a country of approximately 795,000 inhabitants. It has a landmass of 83,000 square miles, roughly half the size of California, of which greater than 70% is rural. Guyana shares its borders with Brazil, Suriname, and Venezuela, and is the only English-speaking country in the South American continent, being a former British territory which gained independence in 1966. Because of language, the country has a deep connection to the English-speaking Caribbean and the Caribbean community. Nearly 21% of the population resides in the capital city of Georgetown. The economy of Guyana is based on abundant natural resources, including bauxite, gold, and diamonds, as well as fertile and productive soil and water resources from numerous rivers and a continental shelf off the Atlantic coast. Healthcare access and spending place Guyana below other Latin American and Caribbean countries. Its GDP was 5.86 in comparison to 7.93 in the surrounding countries, and the total government expenditure for healthcare was at 14.8%. An extremely low percentage of GDP spent on health suggests that not enough resources are mobilized for health, that access to healthcare is insufficient, and that the quality of services is poor. To put this in perspective, the US GDP was 17.1% in 2013. The country of Cuba has assisted Guyana in its deficits by supplying more than 150 healthcare professionals, including physicians, nurses, and allied health workers. Because of the limited capacity at the University of Guyana, greater than 400 students are being trained in Cuba as medical doctors in order to supplement the shortage. Greater than one-third of the country has been living below poverty. Though a major portion of the population is geographically separated from healthcare, the fact that Guyanese pay greater than 86% of healthcare costs out of pocket, it puts it significantly more than neighboring countries. This puts an already unhealthy and impoverished population at greater risk of not accessing healthcare. As it stands, the majority of people already exhibit hypertension by the time they seek medical help. Cardiovascular disease remains the #1 killer consistently in Guyana. Shown here are the percentages of mortality. Though there are other causes, 33% of deaths are due to the disease. The age-adjusted death rates here show that though rates have leveled off for females, they continue to rise for males. This is a multifaceted problem that contributes to cardiovascular disease. Social determinants, physiological factors, lifestyle, and environmental influences are all driving forces that leads to an overabundance of alcohol consumption, obesity, metabolic concerns, risky health behaviors, and hypertension. It's not just one factor that leads to early disease and death. Here we have the sum of years of life lost due to premature mortality and the years of healthy life lost due to disability. The broad group total for cardiovascular disease and diabetes are over 80,000 years. In red, we see here the probability of dying early due to cardiovascular causes. It's on the rise. Though the country receives external financial and organizational support, Guyana primarily addresses its issue of cardiovascular disease in a primary prevention type strategy, as most of the focus is aimed at improving access to healthcare providers, health education in school, reducing access to tobacco and alcohol, lifestyle changes, and access to healthy foods. Unfortunately, the healthcare infrastructure is not capable of supporting those already suffering under cardiovascular disease and the associated illnesses. In 2010, Guyana had 0.21 physicians per thousand people, 72% less than comparable lower middle income countries. Also 0.53 nursing and midwifery care personnel and 0.12 pharmacists per thousand people. As a comparison, the Joint Learning Initiative established a threshold for concentration of doctors, nurses, and midwives at 25 per 10,000 people to achieve 80% coverage. Guyana is at 8.6 per 10,000 people. Because of inadequate numbers of healthcare providers coupled with very few dedicated health ministry employees, the need for a clinical nurse leader to approach treatment is critical to protect what resources are available and assist in creating improved sustainability in the healthcare sector. It is also vital that the CNL contribute to the effective tertiary treatment in order to minimize all the possible sequelae. The CNL competencies require that the nurse address the issues at hand, the contributing factors, and improvement planning. Thank you.